Let me ask you something most men think about but rarely say out loud. What really happens if you ejaculate every single day? Is it beneficial? Is it harmful? Could it improve your performance or quietly drain your energy over time? If you've ever questioned this, you're not alone. I hear this question constantly in my clinic from men of every age. It's one of those subjects that stays in the shadows. Half whispers, myths, even guilt. Yet it sits at the center of men's health, relationships, and confidence. Today, we're breaking that silence. I'm Dr. Hana Kim, men's sexual health, a board-certified urologist with more than 12 years of experience helping men take control of their sexual and overall well-being. And in this video, I'm going to give you the full picture, the 5 surprising benefits of ejaculating daily, the 5 potential drawbacks you need to be aware of, and most importantly, how to know what's right for your body, your goals, and your health. By the end, you'll feel informed, confident, and clear. No shame, no guesswork, but first, tell me in the comments, where are you watching from today? I love seeing this community grow across the world. And while you're there, hit that like button and subscribe, because every week we talk honestly about men's health topics most people avoid. Now, let's get started. Let's clear up the biggest misconception right away. There is no universal answer. Ejaculating daily is not automatically good, and it isn't automatically bad. It depends on why you're doing it, how you're doing it, and what effect it's having on your body and mind. Some men thrive on daily release. Better sleep, less stress, more confidence. Others may find it dulls their desire, drains their energy, or even leads to performance issues over time. So the truth isn't black and white. It's about context. Your biology, your habits, and your stage of life. Let me reassure you. If you've felt unsure about this, it's not because you're uninformed. Most men were never taught how their bodies truly function when it comes to sexual health. That's why, after 12 years as a urologist, I've made it my mission to break complex science into simple, practical advice you can use every day. Think of this conversation as doctor to friend. My role is to help you understand what's happening in your body so you can make informed decisions, not live by fear or myths. And with that, let's explore the 5 surprising benefits of ejaculating every day, followed by the 5 important drawbacks you should know about. Benefit number 1, pleasure hormones and mood regulation. Ever noticed how relaxed you feel afterward? That's not your imagination. When you ejaculate, your brain releases a powerful cocktail of chemicals. Endorphins, your body's natural painkillers. Dopamine, the reward chemical that drives motivation and energy. Oxytocin, the bonding hormone that builds trust and connection. Serotonin, the stabilizer that balances your mood. Biologically, this release helps reset your nervous system. Emotionally, it can ease anxiety, lift your mood, and help you feel more grounded. Practically, that means less tension, fewer emotional outbursts, less bottled up stress, and stronger day-to-day resilience. Daily release becomes a natural reset button, not a cure-all, but a steady support for mental health. Benefit number 2, improved sleep quality. Have you ever noticed feeling heavy-eyed after sex or masturbation? That's thanks to prolactin, a hormone that promotes relaxation and sleep. Combine that with stress-reducing endorphins and oxytocin, and you get a built-in sleep aid. For men who struggle with racing thoughts, stress, or mild insomnia, this can mean falling asleep faster and staying asleep longer. Biologically, it's driven by hormones. Emotionally, it's relief from restless nights. Practically, it means better recovery, sharper focus, and more energy the next day. Benefit number 3, better blood flow and circulation. Orgasm isn't just a brain event. It's a full body exercise. During arousal, your blood vessels expand, your heart rate rises, and circulation increases throughout your body. This vasodilation delivers oxygen and nutrients to your muscles, brain, and skin. Biologically, it's like a mini workout for your vascular system. Emotionally, it boosts confidence by improving erection quality. Practically, it supports cardiovascular responsiveness, an often overlooked aspect of men's health. Benefit number 4, reduced risk of prostate cancer. This is one of the most compelling findings. A major Harvard study that followed over 30,000 men for nearly 20 years found that men who ejaculated 21 times or more per month had a lower risk of prostate cancer. Why? The theory is that ejaculation helps flush the prostate, removing old cells, inflammatory agents, and buildup that could otherwise increase cancer risk. Biologically, it's a natural cleansing process. Emotionally, it offers reassurance about one of men's biggest health fears. Practically, it suggests sexual activity may play a role in protecting prostate health, though it's never a replacement for regular checkups. Benefit number 5, immune system support. Here's a bonus you may not have expected. Research shows that sexual arousal and orgasm can increase levels of IgA, immunoglobulin A, one of your body's first-line defenses against viruses and bacteria. Combine that with reduced stress, which itself strengthens immunity, and you get subtle but real immune support. Biologically, that creates a stronger shield. Emotionally, it brings peace of mind. Practically, it's another reminder that sexual health belongs in overall wellness. Now, we have to be honest. Daily ejaculation is not risk-free. For some men, it can backfire. Here are the 5 biggest drawbacks. Drawback number 1, compulsive behavior. There's a major difference between a healthy habit and an unhealthy. Compulsion. If you're choosing daily ejaculation intentionally for pleasure, stress relief, or intimacy, that's one thing. But if the urge controls you, if it begins interfering with your work, relationships, or focus, then it crosses into compulsive territory. Biologically, compulsive patterns can rewire your reward system. Emotionally, they create guilt and shame. Practically, they drain time, energy, and even intimacy with a partner. The key question to ask yourself is this: am I choosing this, or is it choosing me? Drawback number 2, using it as an emotional crutch. We all deal with stress, boredom, loneliness, or sadness. But when ejaculation becomes your only coping tool, it may be covering deeper emotional needs. Biologically, it builds dependency on one pathway for relief. Emotionally, it can block real healing. Practically, it keeps men from building healthier outlets like exercise, journaling, connection, or therapy. Ejaculation should be one tool, not the only tool. Drawback number 3, lower sperm count when trying to conceive. If you're not trying to have children, this isn't a concern. But if you are, daily ejaculation can reduce sperm concentration. Biologically, sperm need time to replenish, usually 48 to 72 hours. Emotionally, this can add stress for couples facing fertility challenges. Practically, spacing ejaculations every 2 to 3 days during conception efforts may improve your chances. It's not about abstinence, it's about strategy. Drawback number 4, reduced sensitivity or desire. Ironically, too much of a good thing can dull your reward system. Daily ejaculation, especially when rushed or repetitive, can lower sensitivity or reduce spontaneous desire. Biologically, your brain adapts by softening dopamine's impact. Emotionally, this can create a flat, unmotivated feeling. Practically, you may notice less arousal with your partner. Short breaks, even just a few days, can reset sensitivity and restore the spark. Drawback number 5, performance issues if rushed. When daily ejaculation happens through fast, hurried stimulation, your body learns speed. Over time, this can condition premature ejaculation or performance anxiety with a partner. Biologically, your nervous system adapts to sprint mode. Emotionally, it creates frustration for both partners. Practically, it undermines bedroom confidence. The solution is simple: slow down. Practice edging, breath control, or mindful stimulation. Train your body for rhythm, not just release. So what's the bottom line? Daily ejaculation is not automatically good or bad. The real question is why you're doing it. Is it for stress, relief, pleasure, intimacy, or compulsion? How is it affecting you? Are you sleeping better, feeling confident, or noticing fatigue, flatness, or guilt? Does it align with your goals? If you're trying to conceive, do you need to adjust your frequency? Practical tips: pay attention to your body. Track your energy, mood, and libido. Experiment. Try daily. Try spacing out. See what feels best. Create balance. Make sexual release one tool in a larger wellness toolkit. Communicate with your partner if you have one. Never ignore changes in erection quality, pain, or prostate health. Those deserve medical evaluation. If you felt shame, confusion, or even fear around this topic, you're not alone. Sexual health is part of human health. Asking these questions doesn't make you weak, strange, or broken. In fact, it makes you wise. The more you understand your body, the more freedom and dignity you gain in your daily life. Here's the truth. Ejaculating every day can be perfectly healthy, or it can signal habits that need more balance. It's not about rules, it's about awareness. And here's the most empowering part. You have the ability to adjust. Small changes, whether taking a break, slowing down, or using intimacy as connection instead of escape, can give you more energy, confidence, and control. Age is not the end of vitality. Whether you're 30, 50, or 70, your body can adapt. Your health can improve, and your confidence can grow.